So to start off, I want to talk a bit about what we do as speech therapists. We're an allied health profession. You can find us in hospitals, in private centers, rehab centers, and some special schools as well. We diagnose and treat individuals with communication difficulties. So some conditions that we work with include delayed children, autism, Down syndrome, attention deficit disorders, brain injury, cleft lip and palate, and many other conditions that causes communication difficulties. We support families and caregivers. So I always say to my patients that therapy is not just about changing the child, but it's also about changing our perspective of how we deal with our children. I think it's important to kind of see what are communication skills. So I've broken it down into some components. So pre-linguistic skills, speech, language, and pragmatics. This makes up communication. Usually we always say that communication is just talking, but it's not. It's way more than that. So I'll go in a bit of detail. Pre-linguistic skills. So pre-linguistic skills are the non-verbal aspect of communication. It's fundamental to communication. Children start developing these skills from birth and continue to develop it over time for effective communication. So what are some of these pre-verbal skills? They include eye contact. So when I'm talking to someone, having a conversation with someone, I usually have to look at them in the eye. If I'm not looking at them, so I'm looking elsewhere like here, that's not very effective, is it? So even addressing an audience, I'm sort of looking around the room, I'm not facing my back towards you. So next one is turn taking. So turn taking refers to when I'm talking, you're listening, and when you're talking, I'm listening to you, yeah? So babies pick this up from like very early on. When you're talking to your child and you're holding him up, you're making some sounds, and they're staring at you, and then they might reply you with some babble. So that's early turn taking that kids learn, yeah? And next one is joint attention. So this refers to paying attention to the same thing. So you're engaging with someone. So let's say if I'm talking about a cat to you, we both have to be looking at that same cat, so we have to be paying attention at the same things. And then there's gestures. So kids tend to learn gestures before they learn to speak. So if you can think back to maybe some of the children that you have, or your grandchildren, they start waving, they start giving you flying kisses before they actually start talking to you, yeah? So this is an important part of developing your language skills. And also body language. So when we're talking to someone, we always face them, we can't be doing other things while we're having a conversation. Imitation. So again, before you learn your language skills, you usually imitate. So you copy different actions. You also copy word for word sometimes, I can hear some babies babbling in the audience. Okay, so speech. Okay, speech is actually really, really simple. Normally people say, oh, the person has a speech problem because they can't speak. But speech actually only refers to the way you pronounce your words, so how you say your sounds. So it's pretty simple. So some children and adults have a speech delay. It means that they can't say certain sounds properly, or they can't use the sounds in the right place. So for example, a word like rabbit, some children may pronounce it as wabbit. So they really just can't say the sound R. So when people say, oh, I think my child has speech delay because they can't speak, actually that's the wrong term, yeah? So then we go to language. Language is a little bit more complicated. So language is divided into expressive language and receptive language. So expressive language refers to what children say, how much they can say, how much they can produce, what number of words they can use, how they connect their sentences together, how they use their grammar, and how they elaborate, and what purpose are they using the language for? Like, is it to protest? Is it to make comments? Is it to answer your questions? So there are many things that are involved in expressive language. And then there's receptive language, and this refers to how much we understand. And this have to develop, expressive language and receptive language have to develop hand in hand. So we gotta understand in order to produce. So we have to understand what a word means in order to start using the word. Yeah? Similarly with sentences. And the way we learn language is you start off with sounds first, and then you move on to single words, and then you move on to 2 words, 3 words, and then you move on to using complex grammar and sentences. Okay, and the last one is pragmatics. Well, this is underrated, but also a very important part of communication. And this is the social use of language. So some people are not able to maintain appropriate topic. That's not effective communication. And pragmatic skills are things like maintaining topic, saying and doing acceptable things within a social context. For example, if you start cursing or screaming in public, that's not very appropriate use of language. And then there's intent. So some children, they are able to produce long sentences, they can talk and everything, but they don't use their communication intentionally. So you'll find that they'll repeat words and songs, but they won't actually go up to a person and ask them a question, or they won't request using their words, so they're not communicating with intent. Okay, next one we go through to how do children acquire language. So there are a few theories about this. There's nature versus nurture. The innatists believe that language development is a result of genetics, so that all of us, we are programmed, biologically programmed for language. And this is kind of true because universally, we all develop our language similarly across culture. So even if you went across the world, the child will be babbling, they will be making single words, just in different languages. And then there's nurture. So the behaviorists, they believe that language development is a result of environment and exposure. So they need to hear the words many times, they need the modeling, they need the reinforcement in order to learn language. Oh, sorry. Okay, so that's the slide, nature versus nurture. And then we've got the combination of two. So this is what the interactionists believe, and I think this is pretty accurate. It's a mixture of both. How we learn has a genetic component to it, and also have the environmental component to it. Okay, so I'm going to go through a bit of the speech and language milestones for birth to 1 year. So I'm going to go in parts. So I think it's important for us to know what is the norm, the normal development. And once we know the normal development, we can identify that, oh, if my child is not achieving certain things by a certain age, then maybe it's time to do something about it, yeah? So, from 0 to 3 months, in terms of the expressive, okay, they start making eye contact from birth. So they start, when you look at them, they look at you. And they may start making some pleasure sounds. We call that cooing. So it literally sounds like cooing. So they might go, ah, coo, ah, goo, you know, those type of goo, goo, gaga kind of sounds. So that's called cooing. And they might cry differently for different needs. So when they're in pain, the crying sound might sound different from when they're hungry, let's say. And they might smile when they see you. They might start being quite happy, showing you that they're quite happy to see you. And in terms of their hearing and understanding, they might be more in tune to sound. So if someone drops something, they might startle at those loud sounds. And they start being more attentive to your face, especially your facial expressions. If you sort of make different faces at them, they look at you with quite a bit of interest. And they might start quieten down when they hear your voice, or they might start smiling, especially if it's mommy or daddy or people who they're familiar with.